Fatal child abuse is basically any kind of a domestic violence that the child has been subjected to. And when we are referring to a child, it can be a neonate, it can be an infant, as well as it can be an adolescent child. So all of these age groups, different kinds of age groups, are subjected to different kinds of abuse, and sometimes it can prove to be fatal in a lot of cases. So that is what we are discussing over here. The underlying mode of death will be discussed over here in a certain kind of an abuse. Abuse is basically any kind of violence, and it can even relate to slapping or even hurting the neonate, shaking the baby. That is basically known as the shaken baby syndrome, or even any violent trauma hitting the baby, or even subjecting him or her to hot temperatures and causing burns in a lot of cases. So basically, it depends upon the type of abuse that the child has been subjected to, and that will basically allow the mode of death to come into action. So the underlying cause has to be identified, and one has to be quite sure, working as any investigator or solving any case of any medical legal case that may or may not involve a child abuse, and you're suspecting that it is most probably it is a case of child abuse. So you look for clues that are basically pointing out that a certain incident took place in a certain way. So the mode of death again depends upon the method that was implied to, and then we'll be discussing the surface bruising. That is one of the method that the child may be subjected to. That is the involvement of the pressures. And the mostly basically the age group that is subjected to such kind of bruising are the neonates and the infants. That is less than 1 year of age. The children are subjected to such kind of bruising phenomena. So we'll be discussing that, what we're looking for, what are the typical features for that bruising, and what will be the typical sites for that bruising. Because it is very important to differentiate this non-accidental injury from the accidental injuries, because sometimes the innocent parents are trapped into such an investigation, and you'll have to look for signs that it was basically a non-accidental injury or whether it was an accidental injury. The differentiation, it has a very thin line between. So you look for the signs that are pointing towards this. The general aspects and the modes of death are discussed over here in this section. Depending upon, as I've already mentioned, it depends upon the method that was implied for the abuse. That will point out towards the mode of death. And then the surface bruising. It's again very important, a method of abuse that the child is subjected to pressures, and usually these are the sixpenny bruises. They're also known as that because of the index finger that is usually applied that is usually used to put pressure on the chest area or the abdominal areas. And so there are a lot of cases in which such kind of a bruising phenomena was observed. Then the age of bruising is again very important over here, and that we'll also be discussing in detail, because that is basically going to point out if we have different bruises in different age period, that will basically indicate a series of abuse that the child has been subjected to, that it was routine basically for the child that he was subjected to such kind of abuse, and that will basically point out towards the fact that it is not an accident, and basically it was a non-accidental injury. So that is basically the final review of this section. Describing or defining child abuse is a lot of books have defined it in their own way, and over here it's basically the non-accidental physical injury that we're talking about, minimal or fatal, inflicted upon children by persons caring for them. So it's very important that one should keep in their mind that it's not just the outsiders that can be violent to the children. In a lot of cases, it can be the persons caring for them, including the parents, including the siblings, including the close relatives that are involved in these cases of child abuse. So they should be treated as suspects whenever you are investigating such cases of child abuse. Now, in this figure, it's basically a pyramid that is basically showing the adverse childhood experiences, the social, emotional, and cognitive impairment. These are basically the risk factors that are pointing out towards such a scenario of child abuse. And then we have the adoption of health risk behaviors. This is again one of the methods. And then we have the disease, disability, and the social problems that can be at the top of the pyramid. They are of little importance, but still they are there. And then we have the early deaths that are caused due to all of these phenomena. They are basically the underlying causes for the child abuse to occur in a lot of places. Now, the modes of death in child abuse, there are a lot of modes of death that are involved in these cases. As you can see in this figure, it's just pointing out towards the black eyes, especially if they're bilateral. Then basically they raise suspicions towards the child abuse. Then we have the soft tissues of the cheeks. They can be involved. Intraorbital injuries, it's one of the abuse areas that can be involved. Then we have the forearms when raised to protect oneself. So it's basically the self-defense wounds that will be found on the frontal portions of the forearms. And then we have any groin or the genital injury. It can be involved. Inner aspects of thighs, they're involved in a lot of cases. And then we have the soles of the feet, if they're burnt or if the child is forced to walk on some sharp objects. All of these can be they're basically reported in a lot of different cases, and that's how these diagrams are developed. So the ears, especially pinch marks are found on the ears. The triangle of safety, that is the ear, the side of the face and the neck and the top of the shoulders. This is basically known as the triangle of the safety, and it's usually involved in the accidental injuries. Then we have the inner aspects of the arms and the back and the side of the trunk, except directly over the bony spine. So these are basically the areas of injuries involved in the non-accidental injuries and the accidental injuries. The modes of death that are involved in the child abuse, usually they basically refer to the hitting or beating with the hands phenomena. Then we have the shaking, throwing, and the dropping phenomena. Burning and suffocation, that is one of the methods that the child can be abused through. And then we have the head injuries. So these can be basically the underlying causes for the death that can occur in cases of child abuse. Talking about surface bruising, we can have skin bruising phenomena. In a lot of cases, the children are basically subjected to this bruising phenomena. Digital pressures are basically applied on the chest or even on the forearms or even the wrists and the ankles. These are the areas in which these bruising phenomena can be observed. So the bruising around the limbs, the wrists, and the forearms, these are the common sites. The upper arm, the thighs, and around the ankles, these are the common sites in which this bruising phenomena can be seen. One reason can be due to the fact that these areas can be easily bruised, and secondly, these are the areas by which the offender is going to harm the child. Then in small infants, the lower legs bruises are quite common, and child held by leg or ankle in order to swing the child, that will basically cause in the head injuries in the child. And sometimes there is a phenomena in which the father or the mother is playing with the child and he or she accidentally misses the child, and he can just have a head-on injury by a direct blow to the head, by hitting the head of the child with the floor, and that is again going to cause such bruising in a child. So it's quite difficult sometimes to advocate your case whether it was a non-accidental injury or whether it was an accidental injury. Now, buttocks are basically the common areas. We can have the bruising phenomena. The belts are sometimes used. The straps are sometimes used to hit the child at the buttocks area. So these are the areas that have to be looked for the bruising phenomena whenever you are suspecting abuse in a case. Face, especially the cheeks and the mouth areas, as we've already pointed out, it can be the cheeks, it can be the mouth areas. The mouth has to be examined internally as well. Associated damage to the eyes, it's quite common, and sometimes the frenulum is involved, and whenever you examine the mouth internally, you will have injuries on the gums as well as internally on the frenulum as well. Now, these are the injuries, and whenever you will, this picture is basically just giving you an overview that whenever you will get a child and you're suspecting a case of child abuse and you're performing an autopsy, or even if you're performing a clinical examination on a live child and you're suspecting abuse, and you have multiple injuries on the thorax or even on any else part of the body, you'll just write down the injuries. You can have a diagrammatic representation as well. You'll write down the number of the injuries and you'll describe the injuries in detail one by one, as it is done over here. Injury 22, injury 23, 24. It's basically described in detail one by one. So bruises on the chest, abdomen and neck, they are described in detail, and you'll basically comment upon the shape, the color. If it's bruising, you will write down the color of the bruise, because that is going to indicate the age of the bruise. Abdomen and lower chest, deep visceral injuries involved in a lot of cases. And because if you have the CT scans or MRIs done in such a case, you will notice that there'll hemoperitoneum or blood in peritoneum. You can have a lacerated liver. You can have a lacerated pancreas. All of these is basically going to point out towards the abuse, that it has taken place. Small discoid lesions about 1 to 2 centimeters in diameter, they are also known as the six-penny bruises. Now, what is causing these six-penny bruises? It's basically the digital pressure, the pressure of the thumbs that is applied on the chest of the infant or the child, that is going to give rise to that six-penny or the discoid bruises on the thorax or on the front of the chest. Now, the age of the bruise, this diagram is basically indicating the different type of underlying mechanisms that are giving colors to the bruise. That is, we'll initially have a blue and red, and that is basically going to convert into a purple, green, yellow, and then it is going to fade out eventually. So this is basically going to indicate the age of bruise, how much time has passed on. This chart is basically giving you an idea to that. Red color is almost 0 to 2 days. Then we'll have a blue to purple color 2 to 6 days. And then we have green color 5 to 7 days. And then we have a yellow color that is almost indicating that 7 to 10 days have passed on since this bruise has occurred. And then eventually we'll have a brown color after 1 to 2 weeks. And then basically the bruising will fade off after this brown coloration or after this yellow coloration. So basically you'll write down the history, how the bruise occurred, and basically it's going to be from the relatives or the parents or from the people, from the caregivers basically, whosoever are present at that moment, and then indicate the episode of injury at different times. So it's very important that you basically emphasize on the fact that this color changes. Basically, if you have a bruise of this color and then at the same time you have a bruise of this color, that means that these injuries took place at different time periods, and the child has been subjected to continuous abuse during this period. So this is basically quite important medically, and you will basically write it down. If you're writing down an autopsy report, you'll write it down completely and wholly descriptively in your autopsy. Now, basically in this section, we dealt with the different modes of death while the child is subjected to the child abuse, and bruising phenomena that is quite commonly seen in the child abuse cases that is discussed over here. So that is the end to this section. Thank you for watching sqadia.com.